What does the world need to do to help countries recover from the pandemic? We asked global health experts to weigh in as governments and members of the public and private sector convene on May 12 for the second Global COVID-19 Summit, a virtual event hosted by the White House. The event will be live-streamed to the public at 9 a.m. ET. The aim of the summit include finding ways to vaccinate the world. Only about 16% of people in low-income countries have received at least one dose, protect the most vulnerable people from COVID and prepare for the next pandemic. Here are 5 ideas that may or may not come up at the big conference, but that experts we spoke to think are critical. Oyerankoi Banji, an Aspen New Voices Fellow from Nigeria and Vaccine Research and Development Strategy Coordinator at the Coalition for Epidemic Preparedness Innovations. Thanks to high vaccination coverage, access to new antivirals and in some cases low hospitalization rates, many high-income count. Sadly, many African countries continue to grapple with the challenges faced in the early phases of the pandemic. Limited access to personal protective equipment for healthcare workers, diagnostics and therapeutics. Although vaccines are now available, the capacity to distribute and deliver these vaccines remains limited. Over the next few months, African countries must be urgently prioritized and supported in dealing with these challenges. The continued risk of emergence and spread of variants makes this even more urgent. The inequity that still exists is simply unacceptable. The true solutions to Africa's challenges lie in developing capabilities within the region, led by Africans and supported by the world. Fifi Iman, a civil society representative on the World Health Organization's Access to COVID-19 Tools Accelerator program, who is based in the UK. There are health workers in Africa who are not medically trained but who really know how to reach their peers in their communities and how to deploy HE. Unfortunately, their payments are not stable. In fact, according to a 2020 study from the Center for Global Development, only 14% of Africa's 916,000 active community health workers are salaried, while the remaining CHWs are volunteers with some or no compensation. They are doing such important work in the pandemic. They reach out to older people and bring them to vaccination centers. They deploy rapid antigen tests and get people tested in communities.